Before performing the test, make sure to don the PPE. Wear your laboratory gown, mask, head cap, and gloves. Also, do not forget to disinfect your working area. In the physical examination, observe the liquefaction time of the semen. The time of liquefaction is around 1 hour and 20 minutes since it was collected at 2:38 p.m. and liquefied at 3:58 p.m. It can also be observed that the color is grayish-white. Now, measure the semen volume using a graduated cylinder. Transfer the sample from the container to a graduated cylinder. The semen volume is 2.2 ml. Afterwards, proceed to grading the viscosity of the semen. It is graded with 0 since the sample is watery. For the chemical examination, use a reagent strip to determine the pH of the semen. Place 1 drop onto the pH pad of the strip and read after 60 seconds. After 60 seconds, it revealed that the sample has a pH of 8. In the microscopic examination of the sperm, begin with examining the sperm motility. First, prepare a slide for examination. Place 1 drop of semen sample on the slide and then place a cover slip on top of the drop. Now, proceed to microscopy. The sperms of the patient have 80% motility. In the preparation of the smear for sperm morphology and sperm viability, make a sample solution. First, place 1 drop of semen to a test tube. Then, add 2 drops of eosin stain and add 2 drops of nigrosin stain to the tube. Mix the sample and stains using an applicator stick. After mixing, let it stand for 1 minute. Once the sample solution is ready, place 1 drop of sample onto a slide and use a spreader slide to make a smear. In the examination of the smear for sperm viability, it has been observed that there are 76% alive sperm cells and that 24% are dead. While for the sperm morphology, it has been identified that there are 65% normal sperm cells and 35% abnormal sperm cells. Notable characteristics of observed sperm cells are double head, pinhead, double tail, coiled tail, and spermatid. In the examination of sperm concentration and sperm count, prepare a rubber tubing, Neubauer slide, cover slip, WBC pipette, barrel of the syringe, distilled water, and semen sample. First, use the WBC pipette to obtain 0.5 ml of semen sample from the container and allow the pipette to sip distilled water until the 11th mark on the pipette. Then, hold the WBC pipette horizontally and carefully remove the attached rubber tubing. Afterwards, seal the ends of the pipette with the index finger and thumb and mix its contents for 2 minutes. Now, place a cover slip on top of the new Bauer slide. Discard 3 drops of the sample solution before charging the sample to the slide because the sample should be from the bulb of the pipette. After discarding, carefully charge the sample on the sides of the slide and leave it for a minute. Now, proceed to microscopy and focus on the grids of the Neubauer slide. In counting the sperms, you may opt to count on the 4 WBC squares or 5 RBC squares. In the calculation of the sperm concentration, when the 4 WBC squares are used, multiply the total sperms counted with 100,000, while multiplying 1 million to the total sperms counted when the 5 RBC squares are used. The patient's sperm concentration is 4.8 billion sperms per ml. To calculate the sperm count, multiply the volume of the semen to the sperm concentration. The patient's sperm count is 1.056 times 10 to the power of 10 sperms per ejaculation. After performing the procedures, remember to record the results. After the procedure, make sure to dispose all the contaminated and soiled materials in the proper waste bins. Do not forget to disinfect your working area after using it. In doffing the PPE, first wear off the gloves, then the laboratory gown, head cap, and mask. And do not forget to wear off the laboratory shoes. Most importantly, perform the proper hand washing technique.